Building off of what Commissioner Piercy talked about, a lot of times we both will, in our departments, will both be doing things in partnership related to responses to the opioid epidemic. And so what we were going to do in this 10-minute time frame is sort of go over what's happening in our department, what the recent developments have been specific to treatment and recovery services. As Dr. Piercy said, we have both had a huge budget increase related to treatment across the state. And our pretty much lane is that treatment and recovery. So if we can go to the next slide, Matthew. When you look at our department, we take very seriously our mission and our vision, which drives all of our work. Our mission, creating collaborative pathways to resiliency, recovery, and independence for Tennesseans that are living with mental illness and substance use disorders. Our vision, a state of resiliency, recovery, and independence in which Tennesseans living with mental illness and substance use disorders thrive. When you break down our budget, I think this is so important. You'll see that this past fiscal year, we had $452,423,300 that we oversaw. And I want to explain that when Commissioner Barney was here, Lisa, one of his main items was to flip the percentages that went to inpatient and into the community. And you can see we have done so for the first time since the inception of the department under his leadership. We did put more funding into the community than in our hospitals by closing one of the hospitals and then contracting in East Tennessee. So you'll note that for community substance abuse, 27% of the funds that we have and oversee are put in the community. That's $120 million. On the other side, community mental health, 33%, $147 million. And then finally, mental health, $158 million. And one of the things with our institutes that you will note is that middle circle, $425 million, that's going directly in to services. So 95% of the funds that we get from state, federal, and other go directly into services. You will note at the bottom, 70% of our budget is state funded. That's $300 million. And then federal and other amounts to 30%. Our team is amazing. When you look at the dollars that they bring in from discretionary grants, and you'll note right at $151 million when you combine those two together that they have brought in. So going to the next slide. When you look at innovation and substance use services across our state, we like to look at it from a continuum perspective. When you look at what we can do in this state together, one of the first things we focus on is prevention and education. And you'll note very many items that most of you are familiar with, our community coalitions across the state, the media campaigns that we run, the Tennessee Prevention Network, the work that we do with naloxone overdose and prevention, the Red Line referral line, Lifeline Peer Project, and regional overdose prevention specialists that I'll be speaking about in a moment. And then you look at the continuum related to treatment. For those where prevention does not work, treatment is there. Outpatient, residential rehab and halfway houses, detox, medication-assisted treatment. Then when you move into the continuum for addiction and recovery, you'll note transitional housing, Oxford houses, Lifeline, AA and NA meetings, certified faith recovery communities, the Tennessee Recovery app that we had commissioned that our people use once they're out of services. And then the criminal justice diversion. We've been so fortunate under Governor Haslam and Governor Lee to have a focus on individuals that are struggling with addiction and opioid concerns through the criminal justice system, through the DUI schools that we find, the recovery courts, and then the criminal justice liaison services. Going to the next slide. So when you look at all this together, you'll note that for those that received direct treatment services, we had almost 20,000 individuals, primarily uninsured, that received those services. 5,000 served by addictions recovery programs. So those are the wraparound services that we looked at in the continuum. And then 6,238 served by the Tennessee Prevention Network. For the continuum of care, we fund 37 agencies at 80 sites. And as I stated earlier, those are continuum services ranging from outpatient through medically monitored detox. We do have 33 of the 37 that are either co-occurring capable or co-occurring enhanced. As everyone knows, most often when you're working with someone that is dealing with substance use, you will have a corresponding mental health issue. Many times people are trying to self-medicate with that. So it's so important to have providers that can respond to both. The medically managed detox, medically monitored withdrawal management, the medication-assisted treatment programs that we have. And if you would like to look at those programs, I'm so fortunate to have an unbelievable director of communications, Matthew Perriott, who has made sure that our website is user-friendly and easy to navigate. So if you'll go to that link, it will link you to those programs. When you look a little bit deeper into our medication-assisted treatment services, you'll note that we began funding providers back in 2017 with a mix of state and federal funding, providing training, peer sharing, and educating providers. We have seen incredible progress in the funded providers' ability to provide the service to those individuals across our state that can benefit from MAT. So this is exciting. Regional Overdose Prevention Specialist. We have worked a lot with Department of Health, and they've actually given us some extra funding to hire more staff in this area. So one of the things that we know is that naloxone reverses opioid overdose, and we know it saves lives. So one of the programs that we created back in October 2017 is the Regional Overdose Prevention Specialist Group. And you will note that from 2017 to 2020, we have distributed 175,000 kits across the state. And we know on the data that's been presented that 18,000 plus lives have been saved through overdose reversal just due to these individuals. And aren't they an awesome looking group of people? That picture shows you our regional overdose prevention specialist across our state. Going to the next slide. This also shows you exactly where they are, how to get in touch with them. I hope that everyone will get to know their regional overdose prevention specialist. You can schedule an education session with them, call them directly. They are fantastic people. And again, this shows you that we have full coverage across the state to do this work. And then the Tennessee Recovery Navigators, this is awesome too. We started talking about a grant that we had the opportunity to apply for. And one of the things that we thought about was, where is the place that we could do more good, have a high impact that would be low cost as it relates to overdose and people that are struggling. And what we talked about is hospitals, the emergency departments, where people come. And so the individuals that you'll see right here are across our state, funded through local community providers. And they go into emergency rooms, talk with doctors, nurses, and individuals that have actually overdosed or are there for a substance use disorder event. And they themselves have been 2 years or more in recovery. And that gives a credibility that no one else can have. Since our inception in 2018 through June 30th, 2020, 3,776 patients have been seen by the Navigators. 76% of that individual group placed into treatment. That says it all. That rate of being able to help a person decide that treatment's what they need at that moment, that is very, very high. much lower numbers of getting people into treatment when they're not in the ED. So we're just really grateful for these individuals that partner with us and our community providers. Our Lifeline Peer Project, another fantastic program that we started. And you will note there's this list and contact information for all of your Lifeliners. Again, individuals that are in recovery 2 years or more, and they are working across our state to focus on rural communities as well as urban communities to build out those natural supports and resources after a person comes out of treatment or before they go. Coming from Crockett County, one of the things that we knew is that we didn't have an AA group or an NA. Our Lifeliner actually started an NA and AA group there. There's also work that they do with our recovery-based congregations to be able to create welcoming faith communities for when people are coming out of treatment and starting their new life in recovery. All of us know that in order to stay in recovery, you need to be around people that are walking that walk. So we're so proud of what they've done in creating multiple groups of health and hope across our state. And then our faith-based community coordinators, we have 3 that work across the state, interfacing with faith communities to activate recovery supports, training faith leaders on addiction and mental health topics, faith-based organization toolkit. If you are listening and you'd like for your faith-based group to get involved with what we're doing, please go to our website, do the free download. We would love for your community to become a certified recovery congregation and work with our staff that we have out there. When you look at what we've done to date, 768 certified recovery congregations. That means congregations that have been trained, understand, and are there to support members who are in recovery. 676 new recovery meetings started through the Lifeline Peer Project across the state. 14,989 Tennesseans referred to treatment through the Lifeliners. And then finally, 6,352 community trainings that have been held through Lifeline and faith-based initiatives. Our recovery courts, again, very important. We have a total number of 82 with court coverage of 86 of 95 counties. Our community anti-drug coalitions, 46, touch 75% of Tennessee's population, and then 2 additional coalitions focusing on college campuses and increasing the reach of coalitions. Again, please go to tn.gov link for more information. Our Creating Homes initiative, another very important program that we've been able to out the gate match 100% with $3 million from THDA. The focus there is on substance use housing, and we have created since the inception 2 years ago 74 new housing options, and we'll continue to create even more of those. Project Rural Recovery. Lisa, I think you'd like this one. We wrote a grant, federal grant, to bring in dollars to fund 2 different mobile units that are doing both healthcare and behavioral health care. And we have $10 million over 5 years to meet both needs of the underserved areas. Grants were awarded to 2 providers, Buffalo Valley and McNabb Center. And you'll note Middle Tennessee and East Tennessee counties that are covered. Again, go to our link for more information. We're in discussions about increasing this. The governor really supports this idea of going to where the people are rather than putting money into bricks and mortar. Let's go where they are. And we have had great outcomes of individuals that have felt comfortable coming and talking to staff and professionals that are in the vans that are going across these counties. Our behavioral health safety net, just want to make sure everybody on this knows that in our state, we've been able to serve 39,000 plus people. who are struggling with behavioral health issues. And this service is open to anyone in our state that's uninsured and is 138% of federal poverty level or below. We know through our research that our safety net patients are less likely to require inpatient psychiatric care. So getting a lot of great outcomes with that program. And if you are interested and have someone that you know uninsured that's struggling with co-occurring disorders in addition to opioid concerns, please, please, please go to the website and you'll see all the dots. Anybody in any county can get to this service and get what they need. Our Children's Behavioral Health Safety Net, Governor Lee was so wonderful about giving us $7.6 million. The legislature approved it to serve kids that are uninsured or underinsured. Evaluation, individual therapy, group therapy, family therapy, case management, transportation, family support services, psychiatric medication management, and pharmacy assistance are all available for any child, any family, anybody uninsured. We just want to make sure people hear this and come on in and get services. There's the link to go to that. And then finally, our map, you'll see recovery and community resources available. So we talked about the safety net. We talked about the substance abuse continuum of care providers. We talked about the Navigators, the Lifeline Peer Project, regional overdose prevention specialists, faith-based community coordinators. But I want to make sure you have 2 phone numbers that are so vital. If you know a person that's struggling and needs help, needs referral to treatment, the Tennessee Red Line is here. That's 800-889-9789. If you call, they will have a warm handoff 24/7, 365 days a year to that individual to help them get into treatment. Then the Behavioral Health Crisis 1 number, 855 Crisis 1. If you have a person that's struggling with behavioral health, mental health crisis, again, 24/7, 365 days a year. And you'll note more information on all of these resources across our state on our website. In closing, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. It's very clear to me, Lisa, that y'all are that small group of thoughtful, committed citizens. Looking forward to what you do to change the world. And again, appreciate the opportunity to participate today. Thank you so much.